We have mother of Jack sitting in with us today. 2.5 years old Jack is finishing his last 40 hours of oxygen therapy. Annie, if you wouldn't mind just explaining what kinds of improvements you have seen in Jack since.
Sure. Improvements are more vocalizations. Maybe not so much words, but we know that he's got to be creating more sounds. So we went from having very few sounds to more sounds. More tongue play with his mouth. It's like he's discovered his mouth a little bit more. One of the biggest and most positive things, no more spaciness. My mom said to me today that he's purposeful with everything. And he has no problem letting us know what he wants. He wants to be heard and he wants to get what he wants, and that's a bit of a change. Eye contact has been phenomenal. And these changes have all been sort of more recent, like now that we're coming towards the end. And just really good behavior. He didn't really have any behavior issues before, but I feel like we can have conversations, and he's not talking back, but he's understanding and he's following directions really well.
Could you give us an example of something that you might have experienced with him before the treatments to something now?
Well, actually, something that happened yesterday. I could, you know, being 2.5, you're sort of thinking about toilet training. He'll be fine. He might just look out the window. You're thinking about toilet training, so I'd ask him, like, do you need me to change your diaper? And I'd get a blank stare or look off into space. And it was something I wanted to communicate with him more on because I wanted to start this process. And yesterday he kept pointing to his diaper, and I said, do you want me to change your diaper? And he said very clearly, yes, with a nod, yeah. That is something that's absolutely huge. No blank stare. Yes, he was trying to tell me something. He also yesterday, when I was on my cell phone saying that Jack and I were going to go out to a restaurant for lunch, he went, Mama, and was going like this, which is his little sign for dipping French fries. So overhearing a conversation and wanting to interject that he wants French fries. Those are subtleties, but those were not there before. Definitely not.